Alright, so today we are going to be performing an oral mechanism exam with my client here. So I have already spoken with her mother and she has given me consent to go forth with this exam. The first thing that we're going to do is to get us disinfectant wipe, and we're going to wipe down our area, making sure that we wipe down all of the germs and we have a clean surface that we'll be working with. The next thing that we'll do is I'm going to wash my hands, because I will be making some form of physical contact with the client, and so I want to make sure I have clean hands during that time. So to begin our assessment, I'm going to have my client look directly at me, and I am checking out I'm assessing her facial structure, making sure that everything is symmetrical and everything looks normal there, okay? So we can check that out. All right, can you press your lips together like as if you're giving a kiss? Nice, good job. All right, can you give me a smile? Nice, good job. All right, say ah, ooh, e, good. Looks good there. All right, so look straight at me again, and I am going to assess your jaw. Okay, looking at it, can you turn to the front? All right, good. Okay, turn back, good. Good job. All right, so can you open your mouth for me? Okay, I'm going to ask you to move your lower jaw from left to right. Nice, good job. Thank you. All right, so we're going to pause here, and I'm going to go ahead and wash my hands again, and then we're going to apply some gloves, because this is the point where I'll be examining her mouth. And so we want to make sure that we're just being sanitized. All right, have on our gloves. So I'm going to have you to open your mouth, and I'm going to assess your mouth, and then I'm going to have you bite down. Okay, so go ahead and open up for me. Nice and wide, good. All right, nice, looks good in there. The color looks good. It looks very moist, as it should. So can you bite down like this? All right, so I'm going to go ahead and look and check around in there. Nice. She has beautiful teeth. All right, good job. All right, so the next thing that I'm going to have you do is you're going to stick your tongue out. Let's see, you stick your tongue out at me as if you're sticking your tongue out at someone. Okay, nice. And I'm going to have you to move your tongue up and down. Nice, good movement. Now let's do left to right. Good job, good job. All right, looks good there. All right, we can check that off. Okay, good. All right, so for this one, I want to have my client to, you know how you get peanut butter stuck in the roof of your mouth? I'm going to have you take your tongue as if you're trying to get that peanut butter off. So let's see, open up. Yes, just like that. Nice movement there. Very nice. All right, that's good. So the next thing that I will do, you can check that off. The next thing that I will do, I will grab my tongue depressor, and I'm going to have you open up, and we're going to check out your tonsils. I'm going to check out your hard palate, soft palate, make sure all of that is good. Oh, I also need my little light for this. Okay, here we go. All right. Ooh, look up for me. Good. Wow. Stick your tongue out. Wow, that looks awesome. Okay, everything looks nice in there. Good job. Your uvula and your hard palate, all of that looks nice. All right, we can check those things off. All right, so I'm going to remove my gloves because we're pretty much done with those for this moment. So the next thing we're going to work on is your speaking. Okay, so I'm going to have you to say 3 different sounds. First, we're going to do them one at a time, and then we're going to do them in a series. Okay, I want you to say them as fast as you can for 10 seconds. Okay, so the first one is puh. So you're going to say puh as fast as you can for 10 seconds. Right? Here we go. Ready, set, go. Good. Good job. All right. You can stop. Nice. All right. Next one is T. Ready, set, go. Good. Nice job. And the next one is K. Good, 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 good. All right, so now we're going to say pataka, pataka, pataka. As fast as you can. Ready, set, go. Good, good job. That one is tricky. You did good. All right, so do you have any issues with hearing? No? Okay. You feel like you hear very well? Good. What about swallowing? Maybe drinking from a straw when you're eating and swallowing. Any difficulties there? No? Good. No signs of drooling, so we're good with that one. All right, so to conclude our exam, I'm going to have you read a passage for me. So this is going to test your speech and articulation part of this assessment. So I'm going to give you this passage, and if you can read it for me as best as your ability, and then we'll conclude with that.
When the sunlight strikes raindrops in the air, they act like a prism and form a rainbow. The rainbow is a division of white light into many beautiful colors. These take the shape of a long round arch, which is path high above and its two ends apparently beyond the horizon. There is, according to legend, a boiling pot of gold at one end. People look, but no one ever finds it. When a man looks for something beyond his reach, his friends say he is looking for the pot of gold at the end of the rainbow.
Beautiful. All right. That was perfect. Okay, so this concludes our oral mechanism exam. I want to thank my client for being so beautiful and so cooperative in this process. And thank you all for watching. Thank you. Bye-bye.